I'm Dr. Romeo Mitchell, the optometrist here at Ophthalmic Suites. Currently, we're in the Contact Lens Care Center, which also has the post-operative care facility and the optical lab. In this facility, I do all of my contact lens fitting and contact lens care overall is done here. Whether it is scleral lenses for keratoconic patients, or we're doing lenses for astigmatism or just colored fashion contact lenses, all of that is done here in this facility. We have an in-house finishing lab where your glasses are put together here in this facility. So you could wait 10 minutes or so to have your lenses put in your glasses and you're leaving with a fresh pair of glasses because we have the facilities here to do that. One of the conditions that is a lot more prevalent here in Jamaica than I would have thought is the condition of keratoconus. Keratoconus is a condition in which the cornea, the front surface of the eye, steepens, and patients generally don't see well with glasses or, soft lens and that, but they would have been, for the most part, going to see an eye doctor, or maybe not, but for their entire life not able to see clearly. And that condition has to be treated with specialty contact lenses, which are like scleral lenses, which I do fit, and sometimes cornea transplants might get to that. But we have also started the procedure of cross-linking, cornea cross-linking, which actually stave off, sometimes even eliminate the need for a cornea transplant. Ophthalmic Suite operates across the island in 5 locations, namely Ocho Rios, Maypen, Linstead, Kingston here, of course, and Morant Bay, St. Thomas. The patients we see in all of these locations at some point end up coming here to the head facility here in Kingston, because this is where most of our surgical intervention is done. We know that in St. Thomas we don't have a lot of services available out there, and so I think the fact that we have stayed the course and always been out there, patients do appreciate that. In Maypen, it's a different atmosphere, yet still very loyal patients because we've been there for a very long time. Ocho Rios, it's more along the tourist line. A lot of returning residents are in Ocho Rios also, and so they expect the same type of care that they would have gotten, say, in the United States or in the UK. And we tend to provide that type of service here anyway. First world eye care. Here, we might not be considered a first world country, but you get first world service at Ophthalmic Suites.
Yes, it's important to get specific certification, but having a specific certification and just a slit lamp and a flashlight in your hand really doesn't take you where you need to go. The field of ophthalmology is really driven by the technology developers and the technology providers, and it has been overtaken by technology, even though in Jamaica it has been resisted, but I think the resistance has lost the battle. And now, if you are not on pace with the technology, then your patients will maybe just go elsewhere, because people are now searching or they're Googling things and they're coming to you, asking you for certain technology. And so it has become important. I think ophthalmology is even knocking on the door of robotics. And certainly patient information, being able to scan and demonstrate to a patient their pathology, being able to let a patient realize that what they're getting is what they'll be getting in a first world setting has become important. Globalization and technology development has certainly caused the whole eye care just to be one global space where you really have to be on par with what's happening. So Ophthalmic Suites is a technology eye care center, and that is our tagline. And as your technology eye care center, it is our duty to take the latest in technology to our patients. And what drives this need is comfort, is lifestyle. I want the patients to be able to experience vision correction with the least possible downtime, with the least possible discomfort. And so, because we're able with technology to have patients do procedures such as cataract surgery, refractive surgery, lens exchanges, LASIK and so on, and be up and about in 6 hours or maximum a day, driving again back to work the next day. They don't miss a beat in terms of their lifestyle. Technology helps us to provide our patients with this kind of lifestyle. And so that's what drives us to stay on pace with technology, because everything is getting to micro level. Incisions are getting smaller, eyes are getting quieter, downtime is getting less, and vision recovery is getting faster. And so it is the need to keep pace with this kind of development so that the patient's lifestyle can be maintained that keeps ophthalmic suites going. More recently, we've added photodynamic therapy. It's not a new technology, but it's new to the Caribbean, and we are the only place in the Caribbean that has it, and certainly not many places in the United States has it either. Also, we have added MIGS procedures for glaucoma. These are very tiny implants that function pretty well in patients with moderate glaucoma. We have added camera, which is a correction for presbyopia. We all get presbyopia after 40, sooner or later. And so because presbyopia is so prevalent, knowing that we have a LASIK solution that works, people need to know that you don't have to live the rest of your life wearing glasses or reading glasses. You can have a camera inlay implanted in your non-dominant eye, which works very well for seeing prints as small as legal size, those prints that the lawyers don't want you to be able to see.
Funny enough, I've managed to be a patient here, and not just a patient, but also I work here. And so I can actually tell you pretty much what this whole ophthalmic suites or Caribbean LASIK Vision Center is all about on both sides. I had really bad eyesight, meaning that my astigmatism was way up, and my lenses were my prescription was very high. And at my age, I thought there wasn't a lot of options out there for me. Hearing about LASIK, I thought that would have been an option for me, but unfortunately, no. But it didn't stop there. I was given other options, and the other options were just as good as just LASIK because of my age. So I met the salesperson, and he introduced me to Trinova trifocals. It's not a very cheap procedure, but I said, you know what, it's my eyes, and I really wanted to get out of wearing glasses, and so I went ahead. So on August 15, 2019, I went ahead, did my right eye, and I was so excited. When I got up off the chair, I was able to see the clock for the first time. I could tell you what time it was in 37 years without wearing glasses. And that's just one eye. So after that, I came out and I could see everything clear. It's like a newborn, you know, because I haven't been able to do without glasses for so long. Actually, for 3/4 of my life, or really 99% of my life, you know. And this is a first. And I did just one eye on that day. And I went back to work like nothing happened. I was like praising everybody, right? And then the following week I did the other eye. And that was just amazing. Amazing, amazing, amazing. And I've been doing without glasses ever since, and I've not regretted it one day. And I love it. I don't have to, you know, there are times when you feel like you have on your glasses, you know, your physical glasses, and you just go like this, and it's like, oh, but wait, I don't need that. I can see.